Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show. Today, bringing you another really fascinating guest involved in creating a better tomorrow on some really unique fronts. Today, we have the honor of being joined by Gloria Caulfield, who is the Vice President of Strategic Alliances for the Tavistock Group and Executive Director of the Lake Nona Institute, where she works on cultivating a range of relationships and business development efforts that ultimately support the long-term mission of advancing their community health initiatives, as well as advocating for mental well-being, as well as the environment. Gloria specializes in both healthcare and the life sciences, and is a real estate executive for this novel community of Lake Nona, is focused on optimizing health, human potential, and overall well-being in the so-called built environment. And the sort of the defining trait of this really interesting master design Lake Nona community is this commitment to inspire healthy living, encourage lifelong learning, and ultimately embrace the technologies that allow us to get there, as well as emphasizing sustainability along the way. In 2012, Gloria co-founded and launched the Lake Nona Impact Forum, which is a really interesting invitation-only global event for health innovators. It's a really interesting gathering that brings together some of the brightest minds for both health and wellness. In 2016, she led a really interesting group of innovators to create what was known as WIT, or the Wellness Home Built on Innovation and Technology, really a living laboratory to help curate these technologies and different solutions to define healthy living in the residential environment. Gloria is a University of Arizona graduate, had an extensive career in the healthcare field, especially at Florida Hospital, one of the largest admitting hospitals in the country, including time as executive director of community development, as well as employee relation efforts. We're honored to have her with us. A lot of really interesting themes to get into today. Gloria Caulfield, thank you so much for taking time to come on the show.
Well, you're welcome, Ira. It's great to be here.
It's great having you, and I'm this is this whole area, this whole topic is one that we have not touched a lot on previous episodes, so I'm excited to get into it with you. And I'd like to start off like we typically do, by spending a little time with you and learning more about you, because as mentioned, you had a career before this in the hospital world. I have neglected to mention that you also spend time on the board of the American Diabetes Association, American Heart Association. Tell us your story a bit. How did you get involved in health and wellness to begin with?
Yeah, well, I think first of all, well, again, thanks for having me, Ira. And I think, as it relates to health and wellness, it's truly a personal passion. And after working in a large healthcare system, one of the biggest and strongest healthcare delivery systems in the country, here in Central Florida, I think one of my observations in those 15 plus years is that, we really don't spend enough time on thinking about how do we actually keep people well. When you think about the acute healthcare delivery system, it's really designed to catch people as they're falling, whether it's, heart disease or cancer or diabetes or what have you. And, it just occurred to me, and part of my role, at the healthcare system was interacting with large businesses and organizations that always would ask me, what are you all doing for your own employees? How are you, pace setting around wellness? And it's always a tough conversation. And, you come to the realization that, in the current system, it's hard. It's hard to do that with,
Mm-hmm.
the way the systems are set up and the way reimbursement is and so on and so forth. So, so coming over and working with like Nona was sort of an interesting pivot, because then you have this whole community. So this is 17 square miles. And one of the basic premises is that we want to design in health and, optimize quality of life within the community. And it actually started to make sense, because when you think about it, we spend very little time, in healthcare, unless you're really ill. You spend most of your life, within your community ecosystem, whatever that is. And if you could reimagine that, to actually help optimize your health and your well-being, then it really addresses a lot of the gaps that don't exist in the actual healthcare system itself. So that's how I sort of got involved, and how I think about it, and maybe where I saw the opportunity.
Awesome. Yeah, that's such a critical point, and I'm glad you bring that up, because we've been doing some episodes lately, sort of with the folks in the retail side of things, and as you were just pointing out, we go to our doctor maybe once or twice a year, but we're always in our our Walmart or our pharmacy, or in this case in our home in our community, and this is a chance for 365-day a year healthcare. So I'm really glad you brought that up, Gloria. That's an extremely important sort of overarching theme towards everything you're doing now. So that's spot on. When one goes to and we'll put all these links in the bio of the show, but when one goes to the Lake Nona community website, I mean, the first message you get is this is a community of and for the future. And we were chatting about my family road trips down through the area over the last couple of decades, and I've always seen the signs for Lake Nona. I have to admit my stupidity not asking what's going on over there. Give us a little of the history, because strangely enough, in a previous career in the agricultural business, I was down in the area before there was anything there.
Yeah.
It was on oranges. Talk a little bit about what's happened the last couple of decades as this stuff is going. Give us a little of the history, please.
Yeah, no, happy to share that. So as a development company, the land was acquired back in the late 1990s.
Yeah.
And so over time, it was, amassed to this current 17 square miles, 14,000 acres. So, and I think there was definitely a vision that there's collectively a lot of strong benefits. I mean, to have 17 square miles directly next to one of the busiest airports in the country, in a warm weather state that people enjoy coming to for all kinds of reasons. Florida's become increasingly known for business outside of tourism. So we could all sort of see that. And there was a real strategy that was laid down by our executives to look at, what could we do here that helps shape the economy in a way that's very different than what currently exists. And it really even goes back to our former governor, Jeb Bush, at that time, who was, post 9/11. For those of us that have lived in Central Florida for a while, we saw the impacts of what happens when tourism comes to a screeching halt. It's a little frightening, but it also became a catalyst to look at, what are some of the industries that could create great economic prosperity, and the life sciences, that biotech, that became like a North Star for this project. and really a catalyst and sort of a strategic pillar for everything that we've done since.
And the core part of everything that's going on is, within the Lake Nona community, is something you created known as the Lake Nona Institute. So this is a nonprofit, community-focused organization, broadly with this mission, inspiring healthy, sustainable communities of the future. What is the Lake Nona Institute? Sort of, where does it sit? I know there's research teams that talk a little bit about sort of what goes on at the Institute on a daily basis.
Well, yeah, I was going to say, I think what would be helpful to set the stage for that is just to talk about sort of the core of Lake Nona. So if you look at sort of the core of, I call it the economic engine, if you will, we have an 800-acre health and life sciences park innovation cluster that sits right in the center of the project. And over the last, say, 13 to 15 years, there was a very, very brisk set of activities that happen that some may say are fortuitous, but they've come together in the most compelling way. So number one big anchor to really to lay down roots here is University of Central Florida College of Medicine. The university president at that time was looking for a place to anchor his medical school and the future health sciences campus. And of course, I mentioned there was a strategy on the part of Tavistock to do something in life sciences and innovation. And so with that alignment of interests, the organization donated 50 acres of land to the University of Central Florida College of Medicine, $13 million to seed the capital campaign for the building. And that was the first big domino to fall, is securing that anchor. And then there's, some interesting things that came subsequent to that. So the VA, this was the largest metro area in the country that did not have a VA hospital. And so when they were doing their site selection process, which is very, it's a very quiet process in terms of how they go about looking for the right location, one of the big drivers of it coming to Lake Nona was the medical school. So 70% of physicians in the United States actually get their education or some level of training at VA hospitals. So that adjacency was a critical part of the decision making. So now we have a 1.2 million square foot VA healthcare campus, one of the most state-of-the-art and the busiest in the country. And then Nemours Children's Hospital, they had a commitment to building a flagship hospital in Florida, and particularly in Central Florida. And as they were surveying what was happening out here, it became clear that this was the right location for them to come, within our region. And then following on to that is the University of Florida site selecting and coming here with their College of Pharmacy, GuideWell anchoring their innovation, that GuideWell's the largest health plan in the state of Florida, anchoring their innovation center here, Johnson & Johnson bringing the headquarters of their Human Performance Institute, and so on and so forth. So all of what I've mentioned, back to your point at the beginning, going from basically cattle grazing land to this, energized, robust health and life sciences cluster within, say, a decade plus, was just really, really transformative, on so many levels. And I think, kind of going back to the question that you had about the Lake Nona Institute, it's interesting because when you're creating a project like this, it's very inspiring. So it's new, when I first came on the scene in 2011, it was truly a greenfield. with a lot of things in motion under construction. And you bring people here and you're like, okay, what else can we do that's complementary to the mission of Lake Nona? And what is the best way to do it? And that really became the inspiration for setting up the Lake Nona Institute, the not-for-profit. So, on the one hand, you've got all of the activities underway with the development company, very, very important. And then you have this opportunity to do parallel activities that really bring kind of an identity, a culture. It brings sort of a lot of these ideas. It gives a place for ideas to land that help to bring the fabric into the community. And that's really the genesis of the Lake Nona Institute.
So with laying that foundation, you have a series of fascinating programs underneath the umbrella of the Institute. And I thought we could just, chat about a couple of these because they're each equally interesting on their own right. One of the core programs is something known as the Lake Nona Life Project, which, has this mission of basically sort of broadly understanding what keeps someone well, which is, as you were mentioning in your intro, and we've done a lot of shows that focus on this, it's this principle of health span, about sort of, we're all focused on how long we live, but we don't usually think about, the years that we are not well in that lifespan. And you really, brought together an amazing ecosystem of not just research teams to, everything from, topics related to anxiety and sleep and the microbiome, but, work-life balance, social connections, all very important topics. But at the same time, this theme as well of the citizen as a scientist, the proactive nature. Hey, this isn't just some research in a lab. This is about people that live there that want to be part of this endeavor as well. Tell us this story. This is really amazing work.
Yeah, so it just so happens that one of our neighbors here in Lake Nona, one of our anchor communities is Johnson & Johnson and the Johnson & Johnson Human Performance Institute. And I think the thing that's unique that they saw about Lake Nona is that this community was comprised of residents in a rapidly growing residential community. It was comprised of this health and life sciences ecosystem that I just sort of outlined a moment ago. And then there's all of these commercial enterprises. So if you think about just every facet of growing and building a city, we're working on all cylinders doing that. And so, it's a unique situation. And there was this other sort of realization by a core group of researchers from J&J that most research that's done in health and healthcare, the vast majority is done on sick people, sick populations.
Yep.
So, and we can sort of go down the line and say, okay, cancer research and research on rare diseases, and you can kind of go down the line. But what has been vastly understudied is well populations.
Yep.
And the sort of the progressions of disease or the progression of the social determinants of health, and what actually creates the onslaught of disease, and are there interventions that can help to slow the pace of that. So that was the original, I think, thought process around this. And they're like, okay, well, Lake Nona might be a great captive audience because we have a medical and research community, but we also have people that live here. Mm-hmm. And that's sort of a unique set of circumstances. So, and it's interesting because when you're in Lake Nona, you can't help but notice this massive presence of these big research and clinical anchors here. But at the end of the day, a mile down the road, you have thousands of residents. And so So it became just a kind of an interesting opportunity to be able to kick off a project like that here. We now have Dr. Eric Scrimshaw, who's the chair of population health at University of Central Florida College of Medicine, that first big, anchor that I mentioned.
Yep.
And he is the principal investigator on the project. And so a lot of this is, I call it patient research, not like patients like in hospitals, but being patient.
Yep.
Because it's longitudinal. And longitudinal means that you're asking the community to participate in something where there isn't instant gratification. That's hard in a world like ours. So what you're asking for is, there is a gold standard epidemiological survey that's been created by the research team, and it evolves. It has evolved over the years that we've done it, but it allows for our community to be able to respond to the survey and on a whole variety of topics. And then, interestingly enough, as of a couple of years ago, we were also able to start adding some objective data, which is, through one of our big anchors here, the Lake Nona Performance Club. So that's really what the Life Project is all about. And it is, in concept, pattern after the Framingham Heart Study. So really one of the most famous research projects, of our time. And through that, the community is the one that really embraced it, donated their data, and many important questions about cardiovascular disease. Almost every major question has been, in one way or another, linked to the Framingham Heart Study.
No, that's a interesting analogy there, and that especially to the extent of how much that taught us, and ultimately, the fact that
there were so many things, Ira, when you think about it, like, smoking, linking smoking to heart disease. I mean, it's hard to imagine that wasn't known, but it came out of the Framingham. The whole area of obesity, and I mean, the list goes on of things that we now is just common knowledge, but a lot of that work and that insight came out of Framingham.
Absolutely. Another part of this is this really interesting program I mentioned in your bio called WIT, or the Wellness Home Built Innovation Technology. And being a huge Disney fan, it got me thinking. Back in 1957, Disney created this House of the Future. It was by MIT, and Monsanto was there. It was more about the versatility of modern plastics, but again, this principle of, hey, creating sort of, you talked about the citizen scientist, and now here's the per the built system, sort of a living, evolving home ecosystem to test out some of these novel technologies, and some of the things that you've been studying, and sleep sanctuaries, wellness kitchens, all sorts of interesting things with smart lighting and windows. Talk about WIT, because this is another, as we get into the theme a lot of aging in place, smart home, hospital in the home, and a lot of these new digital tools that are coming our way. I mean, it just seems like, again, you have a perfect laboratory here for testing out not just the new technologies, but really the synergy of them all in keeping us well.
Yeah, so the wellness home built on innovative technology. I mean, we co-founded that with one of my colleagues here in Lake Nona, and it really, the thought process sort of came out of, if we're thinking about optimizing health and human potential in the built environment, and we're thinking about this whole sort of future-facing community, then you can't ignore the structures that we live and work in. So, 92% of our time as modern day humans is spent inside. Now, it could be higher for some, but the point is that the overwhelming amount of our day is spent indoors. And one might argue, do we live in healthy homes? Do we live in healthy workplaces? And I would say most people would say yes to that, but with what metric behind it, And so we took this house just knowing that we have this unique set of collaborators in our, Lake Nona Medical City.
Mm-hmm.
And we wanted a place as a Lake Nona living lab where we could also have room at the table for entrepreneurs and startups and, people that just had cool ideas, maybe not, as large as some of our big anchors. We wanted there to be this ongoing question: what is a healthy home? And what is it that we could bring into a home and learn from? And so, we evolve this all the time. It's never just like, we opened this like 7, 8 years ago, but, every year we're constantly updating and refreshing what's in there. But to your point, we've engaged with partners that are very entrepreneurial architects to bring in what is the wellness kitchen of the future? That's where we make a lot of decisions. In our kitchen, socially, emotionally and nutrition, what we're eating. And so we found a really unique architect that had a whole different vision for what if you were not focused on prepared processed foods, you would design a kitchen completely different. And we had the first installation here in Lake Nona. We, to your point, sleep. That's one of the biggest public health crises. And some people think it's a badge of honor if they only need 3 or 4 hours of sleep. I would say that's not a badge of honor. It's, it's going to lead to health problems eventually. So, but we had a great partner, Sleep Score out of California, that came in and said, okay, we're going to create the best sleep sanctuary that exists anywhere with all of these technologies and so on and so forth. So it's really about constantly challenging ourselves to think about the residential lived experience and how do we continue to optimize that, get ideas from it. Some of the products in there technologies are commercially available right away. Some are still aspirational, but it's kind of fun to have a blend of both.
Mm-hmm. And while we're on the topic of WIT, just because you mentioned, sort of the, not just the big anchors, the J&Js and so, but you do have, I was reading a couple months ago, you announced this really interesting innovation competition related to WIT and some group called Welltech Ventures. And if you could just say a couple words about that, because I know you have a sort of a review panel with some pretty big Daniel Kraft, John Driscoll from Walgreens. Those must be fun to sort of see the startups come in and pitch stuff. Say a couple words about the competition, but if you could say who you.
So there's a venture company there out of Tel Aviv, Welltech Ventures. And one of the principals was in Lake Nona this past February. He was actually he came across for the forum. And, he came to me after and said, I have some ideas about how we might be able to collaborate. And so the thought process is that we have all of these different dimensions within WIT, like we already mentioned, the kitchen and the bedroom and air quality and, and so on and so forth. And so we partnered with them to create a global innovation challenge with the idea that we would have one clear winner, but we'd also be able to source, a number of other great ideas that fall in line with the mission of WIT. And so we had our demo day a couple of weeks ago, and you're right, we have great turnout in terms of the judges. John Driscoll, the president of Walgreens Health, Daniel Kraft, goodness, we had representatives from Guidewell and KPMG. So a lot of our big anchors, but also a lot of our ecosystem, if you will, that came together to help select the winner.
That's awesome. That must be fun.
It was a lot of fun.
Yeah. So again, and we're going to put the links to the various parts of the organization into the bio of the show, Gloria. But I was just wondering, I mean, because clearly people can go in and see a lot of the stuff that's happening. I was reading about Fountain Life, which is an organization I'm familiar with in terms of precision diagnostics. You got this really interesting smart window hotel. What else are you personally? I mean, as I mentioned in your bio, aside from what you do, you're involved with the American Diabetes Association, American Heart Association, this interesting group called Shepherd's Hope, which is related to, ensuring the uninsured. What kinds of things do you look? I mean, what do you hope to see enter the ecosystem if they're not there yet, or things you read about, other technologies, companies you might want to bring to the institute? What else excites you?
Yeah, it's a great question. I think our biggest opportunity is around health span and longevity. So I think we could all agree that nobody really wants to live to 100 plus if it is, in a fragile, not optimal physical and mental state. Right. But I think we're turning the corner on a lot of knowledge, a lot of breakthroughs that are going to be game changers in this. And we have great partners, as you mentioned, like Fountain Life, that are pace setters in this. But when I look into the future, and I think from a health perspective, what could our identity be? I think our identity could squarely fit around optimizing health span and longevity. We have all the right components here with partners, with medical schools, with colleges of pharmacy, with the community itself. So that's when I look into the future, that's where I see so much potential for us.
So going into the future now, clearly an important piece of discussing the future, as I mentioned in your bio again, is your Lake Nona Impact Forum, which is an invite. I mean, presidents, prime ministers. I see that Brooke Shields is going to be at the one in 2024. Big fan.
No, she actually came in. I want to say it was 2019. So she was a past.
Oh, past. Okay, I was looking at the piece. Anyway, you got a lot of the luminaries from government, from industry, from academia. Some which I had on the show. It's a really awesome list here. Talk about the Impact Forum. What happens there? What highlights of what's coming up for 2024?
Yeah. Please. So the Impact Forum is it's an opportunity for some of the greatest minds in health innovation to come together annually to talk about some of the most pressing issues, in this whole domain of health. And so I founded the event in 2012. So that was our first edition. We're getting ready to execute here on edition number 12, which will be at the end of February. And, I think part of the vision here is sort of coming into the project with fresh eyes in 2011, seeing all of this rapid pace of development that was happening, understanding clearly from our leaders what the mission and vision, what this community needs to stand for, and it really kind of became clear that, at least for me, that as we're building this incredible ecosystem, as we're building out this city, this of the future, that what makes that great and really what makes it pop is a collection of great intellect and ideas and people that are just viewing the world differently. And so that really became the impetus for the forum, because it was very common for me to tour people at, luminaries in different fields. And the common denominator from almost all of those tours was like, wow, I never knew this existed.
Mhm.
And wow, this is very inspiring. And, would get people to want to think and imagine and create. So the thought process was, what if we could get several hundred people together at one time and have more of an intentional structure around conversation. And that's how the whole thing took off. And now we're in year 12. So you're right. I mean, over time, we've had great thought leaders, but we've also had some interesting I call it historic moments. So this year, as an example, we have a great relationship with Microsoft, and they chose to utilize the Impact Forum as the place where they were going to unveil Chat GPT-4 and their early thoughts about how that could impact healthcare, how it could, start to solve some problems in healthcare. In 2022, President Clinton was here. He was being interviewed by Sanjay Gupta. The day that he arrived was the day that Russia invaded Ukraine. So we had this moment where we had a former president sitting on stage, basically giving us his take on what this means and what that represented and so on. And then in 2020, February of 2020, we had the last health innovation event before the great pandemic. And we just happened to have several members of the Trump administration on our stage, and we pivoted and talked about COVID-19 before there was even the first press conference on it. So we've had this like uncanny timing. I don't think you can necessarily count on that every year, but the timing and the content and a place where safe conversations can happen.
And it's going to be, I wish it could be a fly on the wall, but just for everyone listening or watching, some of the sub themes: quantum computing, gene editing, longevity moonshots. This one, food, the ultimate prescription. We just did a show on food as medicine. So yeah, this is really awesome stuff. I'm excited for you.
No,
I'm excited
thank
for
you. Well, and then just to give you a little sneak preview of what's coming, Ira, so one of the modules, I think it's probably well known to you that Lake Nona sits about 40 minutes down the road from the Space Coast.
Yep.
And so we wanted to do something on space, and particularly commercial space travel. And so in 24, we have Jeff Bezos coming to speak, the founder of Blue Origin and this little company called Amazon.
I've heard of it.
May have heard of him. And then Gwen Shotwell, the president and chief operating officer of SpaceX.
Yep.
So Gwen's coming. And then we have the most experienced astronaut in the history of the space program. Her name is Peggy Whitson. And so she was the director of the astronaut program at NASA. And then now she's actually working for a commercial company called Axiom. And so a lot of this is, so you might say to yourself, why would we be tackling a topic like space at a health innovation conference? And it matters on a lot of levels. One is, if you really peel back the onion with like Blue Origin as an example, one of their missions around the company is climate change.
Yeah.
And so they're going to be talking a lot to us. Of course, we see climate change as a public health crisis. And so, this relationship between commercial space companies and their own missions around climate, I think will be very interesting. And then, of course, there's a tremendous amount of research that's being done on the International Space Station in medicine.
Yep.
And so on. So we're going to be looking a lot at that topic. We have some very exciting discussions around nursing. It's interesting how that largely gets ignored
Yeah.
at a lot of innovation summits. But we're taking it head on, and we're going to have some very, very high profile discussions on that. And then we're going to be bringing in the titans of tech. And so we're going to do a follow-up. 10 plus years ago, Ira, you probably would have never brought, these big tech companies to the table for a health innovation summit. And now they're in the middle of everything.
Yep.
Oracle, Microsoft, Google, et cetera. So we have a lot going on, and hopefully very, very important and stimulating conversation.
Extremely timely, especially I love the space connection because we've been profiling some of those folks as well, and there's a lot of important things aside from how we keep people healthy up there for long trips. It's the things we learned about resilience in space do a lot for us down here as well. So no, I'm really excited about that.
Yeah, and I think the other thing I was just going to mention is really over time after doing this is now, as I mentioned, year 12. I think one of the North Stars for me is bringing people together that wouldn't have otherwise connected and watch great and important work develop from that. Mm-hmm. So as an example, we have a physician scientist by the name of Dr. David Feigenbaum who came to speak. Yep. in 22. Are you familiar with David's story?
I've had him on the show. His lab's down the street, but I know David.
He's great. So he came here to speak in 22. We helped him organize his TED Talk. He did a compelling job. He got a standing ovation. But that day, it just so happened that President Clinton was watching him from the green room. And Nubar Fan, the chairman of Flagship Pioneering, was sitting in the audience, and others. And as a result of that, there was a lot of important momentum that shaped Every Cure, the organization, the research organization. He has now stood up. Yep. And to have someone like David say to me that I now have real clarity and I got real momentum, and I am now saving other people's lives as a result of coming to the forum. That's the North Star in terms of really important work versus just great people came together and had stimulating conversations and then nothing really took traction after that.
Yeah, I'm very aware of David's story. I was unaware of the connection to you, so I think that's amazing. Obviously, I've seen him with Bill Clinton and Katie Couric and everybody. I'm saying, okay, now it all makes sense. But that's really awesome. And again, I mean the multiplicative effect of what happens in that couple of days, I think, is just can't be understated. That's really, really amazing stuff, Gloria. I'm excited. I'm excited for you. I'm excited for the forum and to continue to watch what you're up to. It's just it's really again and to come from again sort of empty space to build something like this and to continue to have it as this working living laboratory of the future is just so exciting, and so really happy for you. Before we wrap up, anything that I missed that we should beyond the forum, things for 2024 that are coming up that we should know about, please take the floor. I just make sure I didn't not touch something.
Yeah, I mean, I would say that you know, the one thing that we didn't talk about that I think is important is we have a very unique project here. And again, something that I've been working on for many years called the Lake Nona Performance Club.
Hmm.
And I mention it because when I first came into the role and I heard like what our mission and vision was, I'm thinking what do we create in terms of fitness and performance that will actually make a difference and that will also have broad appeal to a really diverse group of stakeholders.
Hmm.
So when you think about, Lake Nona, we have elite athletes, amateur athletes, we have these big companies, you have the medical community, both patients as well as as employers, um, and there's residents, and it's just a very unique situation. And then and I did my research, and I'm like, okay, if you look at the average retail fitness facility, Ira, it's interesting or attractive to about 14% of our population. So the model usually is sell memberships and hope they don't come, right? So that you can kind of keep the
Right.
operations in check. So I'm like, that's actually the opposite of what we want.
Right.
We want, if we're really going to be a facility around health and wellness and all these things, it's like we need to have something that is attractive to a large swath of the population. We need to have different things for different people so that people will stay engaged in fitness and performance and so on and so forth. So that has led us to 2 years ago, right in the height of the pandemic, we opened the Lake Nona Performance Club, which is a state-of-the-art fitness, performance, and mind-body facility. And there's clinical space that's built right into the footprint, which means that if you're a patient that's going to see a primary care doctor or sports medicine or what have you, that you're literally walking into a fitness center to do that.
Hmm.
And it also allows for, this really seamless transition from patient to a handoff to people that are trained to be able to supervise you on the fitness floor for whatever your condition is, whether you're trying to lose weight or you're transitioning from a sports injury or what have you. And so there's that clinical integration into the fitness and performance.
Mm-hmm.
There's also a very large component that's strictly focused on athletic performance and has all of the facilities and the specialists that you would need to be able to train, elite or emerging athletes. But then most importantly, we really built and developed a relationship with Dr. Deepak Chopra.
Yep.
And we did that because we wanted to have world-class mind-body practices. We wanted to have a place that had evidence-based, meditation and yoga and so on. And that cross-pollination, even with athletic performance, is so powerful. So I wanted to mention this because I think this is trying to take all the components that can be somewhat fragmented
Sure.
and putting it together in one more intuitive and kind of accessible process or format so that, we have a welcoming environment, no matter where you are in your journey, that you will feel welcome and there's something in there for you. And then, two, to be able to also alleviate what is not available in most physician practices, which is, a handoff to a fitness expert that can help you with your goals, or a nutrition expert or what have you. So this is something very unique that again is missing when we started off this conversation. It's like, what's missing?
Yep.
That could really help people stay well. This was a piece that was missing. And then also it creates a foundation for research,
Yep.
because as our members are coming through, we have, we're a full Technogym shop. And I don't mention that to promote Technogym, but they have software that allows us to track everything.
Yeah.
And gives us insights, on aggregate data and so on and so forth. So that's something that I think we need more of. I think we have, a good running start in Lake Nona of kind of creating a new model for fitness and performance. So by the way, what we're hoping is that within 5 years, we would have about 12,000 members. In 2 years, we have over 10,000 members.
Wow.
And we average about 2,000 visits a day. So what that tells you is the theory of build something that has a broad swath of opportunities for people, that, it will engage people and they'll come and so on. So anyway, it's just a project that I think is unique, but we're excited about.
Yeah, no, it's synergistic. It's it's an ecosystem. It's elegant. And yeah, as going back to the beginning, you're ultimately shifting the conversation from sick care to well care and health span, and yeah, I'm just, again, I'm excited for you. I'm excited with what's going on. And just, I hope to be able to do a follow-up with you at some point to continue to see the evolution of the ecosystem. Really, really great stuff, Gloria.
Thank you.
One again, for everybody who is going to be listening to this particular episode of our show across the various podcast networks, or watching on our YouTube channel. Again, you've been spending time with Gloria Caulfield, who is Vice President of Strategic Alliances at Tavistock Group, Executive Director, Lake Nona Institute, doing really amazing things to not just build a community of and for the future, but to inspire these future communities for healthy, sustainable living. Gloria, again, I want to thank you for taking the time out of your schedule to come talk to us for a little while about what you're up to there. Obviously, thank you for doing it. And as we like to say on our show here, thanks for helping to create a better tomorrow for so many people via what you're building. A really awesome story.
You're welcome. It's been a pleasure, Ira. Thank you. And I'm happy to come back and do a check-in anytime.
Let's do it again. Be well.
Okay, take care.
Bye-bye.